I think we're going to start with Dr. Amin. And Dr. Amin was going to give us a little bit of information about why he thinks we ought to all take the vaccine. Dr. Amin?
Sure.
Yes,
thank
sir.
you, Ted.
Thank you.
Well, thank you for the opportunity and allowing me to kind of make my pitch be worthwhile, hopefully, for everybody. I very, very passionately believe that one shot we have about protecting and reaching towards herd immunity with this massive pandemic that I've never seen in my lifetime, and most people probably have not. We finally have some form of an ability to be able to wrap our arms around it, and we need to accept it. I have no doubt about the vaccine itself. I can tell you about the vaccine, how it's made briefly, in hopefully in as easy words as I can, and to just let it be known that I'm scheduled to receive my first dose of the Pfizer vaccine tomorrow at 2:45. And I'm headed to the vaccine site. I'll have my picture taken, and if anybody wants the proof, I'll have it posted. You know, there is, I really have very little doubt about the side effects. I know in the media, there is a lot of fear that's been generated, but I would much rather take the vaccine than the virus itself. And here's why. The vaccine is a new form of an immunity. It's not the old style where they take the virus and are giving you either the live virus or giving you inactivated virus. This is not a virus that we are receiving when we take this vaccine. We are receiving a piece of an RNA, which is the genome of the vaccine, and it is a modified laboratory-made piece of protein, essentially piece of proteins that are put together that in essence, our body is going to then make the proteins that are going to fight the virus should we encounter the virus. So it is kind of like giving us some form of an armament, tools to be able to fight the virus when we catch it. It is not live virus, it is not inactivated virus. So if we are going to go into a battlefield, do I want to go into a battlefield and fight the battle that I know we have to fight, that all of us are fighting and have to continue to fight? None of us are in a position to really walk away from this thing. So if we have to go into this battlefield, and we have been in the battlefield, and if somebody wants us to use a tool that can help protect me, do I want it? Yes, I want it. So that's probably the easiest way I can put it to anybody, and anybody who is doubting the vaccine and who is doubting the efficacy of the vaccine. It is it has gone through enough of the CDC, I mean, not the CDC, but the FDA regulations that we finally have it. Even though there has been an EUA that has been granted for the Moderna vaccine that was done in emergency setting. But if you look at the data that's out there, the difference between the Pfizer vaccine and the Moderna vaccine, 95% effectiveness versus 94.5% effectiveness, to me, that's irrelevant. So whichever one we can get, they're both made the same way. They're both mRNA injections. And it's, I really don't have any doubt in my mind that we need to go ahead and embrace it and get it, especially in a setting where we need to protect ourselves so we can protect the residents. I personally have my parents who live with me, and for me, going to work, going home, it's the same thing. So I don't want to carry from my work to home. I don't want to carry it from my home to my work. So all the more reason, as soon as I saw the opportunity to be able to get the vaccine for myself, I was the first one to sign up for it. I think it became available at a midnight, and whatever midnight that it became available, the whole schedule was blank. And my name was the first one there at my available schedule. So that's how passionately I feel about it. And if anybody has any questions about the vaccine itself or wants to understand about it, please reach out. I'm always all ears.
Very good. Well, thank you, Dr. Amin, for sharing with us. Dr. Corder, and if you're on mute, you can unmute yourself. We understand that you took the vaccine during the trial, so you got a jump on most everybody. And would you mind sharing your experience with that, please?
Yeah, absolutely, Ted. Thanks, everybody. I'm Dr. Steve Corder. I'm the medical director at Trinity Ridge in Hickory. And I did sign up for the trial. I've had the vaccine, and as far as I can tell, there's no government trackers yet or any kind of some weird stuff on the internet. No, here's the deal. So actually a drug rep friend of mine had sent out on Facebook, that they were doing a trials here in Hickory, part of the Pfizer deal. And I thought, those of us that can and should, I'm the age group they were looking for, the older age group. So I signed up to the trial and they called me in, and you signed a bunch of paperwork. They gave you a lot of data about the mRNA vaccines. As many of you know, the question I always get, well, this is brand new. And I'm like, no, it's not really brand new. The Ebola vaccine was based on similar types of vaccines. It's going really well. There's not been any big issues in that vaccine. So it's not a brand new technology like everybody thinks it is. It's brand new for this virus, and it's brand new in the US. So that made me feel a little better. I did a lot of research in it before I actually signed all the papers. So people always ask me, what happened after you got the vaccine? The first one, I'm not gonna lie, it felt like a tetanus shot in that, I get the flu shot every year, never even noticed. My arms never sore, wouldn't know I had it except for the pinch getting it. My arm was sore, like a tetanus shot, kind of sore for about 3 days after the first one. No other side effects. And then 3 weeks later, I go back, they give me the second one. They also do antibody tests and whatnot after that. And after the second one, same thing. I had about a 3-day really arm soreness, and I had about a day of just feeling kind of a little achy, some myalgias, a little tired, no respiratory symptoms, no fever, nothing else. It lasted a day, and I still functioned that day. I didn't take off, but I just felt kind of blah for about a day. It passed. Since then, I've had no further symptoms. I have gone back for some titers, and they actually, when you sign up for the trial, they actually agree to come back for up to 2 years so that they can see if there's going to be long-lasting immunity. Because the question the next I get from a lot of my nurses in my facilities is, do you think, is this going to be a yearly shot? And the answer is right now, no, probably. As you know, influenza vaccines, influenza viruses mutate very rapidly every year. And so the immunization you got last year, doesn't work very well for this year. So maybe a little carryover, but there's a lot of new strains. Coronaviruses in general, from my understanding and reading, don't have that type of rapid mutations, but they do mutate. I'm sure you guys have seen in this week in the UK, there is a new strain. Virus is still covered. It hasn't changed the mRNA part of it as far as what the antigen you would get from the vaccine. So at this point, it's not an annual. If there are mutations in the future that make the vaccine inactivated, there may be some kind of a booster you would need for that. But as of now, it's not planned to be an annual vaccine. And then the last question I always get from people is, do you really think it's safe? I'm like, I signed up for the trial. Of course I think it's safe. I'm a vaccine supporter anyway. I used to do some travel for some missions and whatnot, and I've always taken all the vaccines you had to get for all that. Something like yellow fever and all kind of weird stuff you used to have to get. And by and large, other than just feeling a little draggy if you get a little immune response from that stuff, there's really not a lot of other side effects. There's not been any bad neurologic side effects associated with this one so far. And if they do occur, they're going to be very rare. There's always risk with everything you take. There's a couple of nurses had some anaphylactic reactions, but you can get that to anything. But with this Ebola virus, it's risk benefit. We know what the risk of getting the COVID virus is. We know what the risk is with that. And particularly, we know what the risk is in our residents. You've just got the numbers, and that's what we're seeing pretty much nationwide. About 15% of the patients in nursing homes that get COVID die. I mean, that's crazy. The influenza yearly is about 5%. So we're talking about triple a bad flu year worth of deaths. And as I've told my nurses in my facilities, this is my biggest pitch. It's not that you need to get the vaccine so you don't get COVID. You need to get the vaccine because we're taking care of poor health elderly individuals. And pick that favorite resident of yours at the nursing home that you would hate to see die. And if I said to you, here, I'll give you a pill and this will save Mabel and she won't die, you would take the pill. I've actually had a couple of my favorite residents die that I've had for 15 years in a couple of buildings. And it's just been awful. You know, if I'd have had the vaccine earlier and be able to take it, I would have. And I think when we work in long-term care, we have a responsibility to do the right thing. And I know nobody likes to get shots and everybody's afraid of getting side effects. And the data on this is pretty clean. Could you possibly get some side effects? Yes. But would you be willing to put up with that if it's going to save those 2 or 3 or 15% of the residents that get this at your facility? I think most people would say yes. So that's my spiel. As this goes, time goes on, if anybody has any questions, like Dr. Amin, I'm available anytime with you. And Ted, you know how to get a hold of me or the facility at Trinity Ridge, or feel free to give me a buzz.
Very good. Thank you very much. Dr. Herman, if you can unmute yourself and if you could add your 2 cents on how you feel about the vaccine and its safety. Any words of wisdom, we'd be thrilled to hear from you.
Sure. Yeah. Again, I appreciate as well, just like others have said, the opportunity to talk with you guys. I do feel it's really important to remember, as has already been said, we are still in the middle of a public health emergency. I mean, this is not going away, you know, with the way it's been handled so far. You know, you look at the stats, it's just a logarithmic increase in a sense, just constant, you know, more and more cases come along. And the, you know, the associated deaths that we've seen. So it's, you know, been very sad to see. And unfortunately, our efforts have not been, you know, as effective as we would have liked. So here we are. We've got an opportunity here, you know, to not only help ourselves, but also help our family members and the residents, as has already been said. You know, I do feel that the safety profile of this is pretty incredible. The FDA, when it approves vaccines, usually only requires around 3,000 participants in the vaccine trial in order to evaluate the safety of the vaccine. Well, you know, between the 2 that have already been released, you know, through the EUA, there's over 75,000 participants, you know, in the trial. So to me, that's pretty impressive. That, you know, if we're going to know what the side effect profiles are, you know, we pretty much know them now. You know, much like, you know, Steve had mentioned that, you know, is the possibility, you know, that during each of the 2 injections that you might experience some, you know, fatigue and localized pain in the arm and the like. And really, you know, as been described by to me, is that that's a great indicator that your body is responding to the vaccine itself, that it's out there making those antibodies so that it is preparing itself, that it's ever exposed to COVID in the future. It's got those antibodies available to just, you know, basically, you know, kick its butt, you know, and you know, knock that infection down and all. The other thing I thought was very impressive is that, you know, we certainly all know that within the healthcare environment, a lot of times there's some disparity that exists, and, you know, especially when they're doing recruitment for vaccine trials, that usually there's a high number of Caucasian individuals that are involved. But this has been shown to be one of the more, you know, diverse kind of trials that have been out there in quite some time, where they're looking at around 40% of the participants were, you know, African American, Asian, or Latino that were involved in this trial, which is pretty amazing. So, you know, even across the differences, you know, the uniqueness that each of us have in how we're made, it, you know, again, kind of shows that safety is present. I think the other thing too is as already been said, like with Dr. Amin described, that, you know, we're only getting kind of some mRNA that tells the body to start making antibodies to a piece, you know, of the coronavirus. And what is kind of described to me is that, you know, when we all think about the big picture, the picture of the coronavirus that we've seen from those electron microscope pictures, it's a big ball with a lot of spikes on it. And, you know, and what these antibodies are to the spikes, you know, these proteins that hang out on the outside of it. And so that's what it's for. And then when the body's, you know, done making the antibodies, it actually gets rid of that mRNA protein that was in the vaccine. So that's gone completely, you know, it's kind of thrown in the trash, so to speak. So I think it's really important to recognize that, and which really speaks to the thing that you cannot, this vaccine, it's impossible to get COVID-19 from the vaccine. Because again, you're only getting a part, which is a message that tells the body to create a protein that then produces that antibody to the spike on the outside of the protein. So you cannot get it. Again, I really feel that, it's important to recognize that. Also, just as they went through these studies, even outside of the FDA, there were two, large independent advisory committees that went through all the research and were very confident in what was done. So it is pretty stunning just what science has come to now, and just how quickly we've gotten this virus, instead of having to go through the live virus or live killed virus that normally we've had in other vaccines like the flu vaccine. And here, we're getting straight to the point and producing these things to have some effectiveness in our patients.
Very good. Well, thank you for sharing. And Dr. Roberts, if you're on the phone, if you can, or on the Zoom call, got to get used to that new technology. If you can unmute and give us any perspective that you have.
Ted, I did not see him on the call. I scrolled through. I'm not sure if he had office hours or not.
Yeah, okay. He may not have been able to do this, but he shared with us this morning in a call, which was very similar to this. And this has been so helpful. But he said something that was really interesting that I thought that stuck with me. I think stuck with all of us. He said, we wrote it down. Vaccines do not save lives. Vaccinations save lives. And I thought that was a good point to remember as we consider whether we're going to take this vaccination or not, because it certainly will save lives. And that's our family and our work family, especially that are included. Are there any other doctors? I know some of the doctors were making rounds this afternoon. Are there any others that are on the phone that would like to say something? If not, Keisha, I think you were going to share some of the demographic totals, and also if you'll go ahead and hit the county positivity ratings while you're at it.
Okay. So can you see that screen okay?
Yes.
Okay, perfect. So this is from the DHHS dashboard that is open to anyone to view. But one important point that we thought that we would share with you all is that if you look at the age demographics for North Carolina from the beginning of this pandemic, most of the time we hear people saying that it affects those that are 75 and older. But if you look at North Carolina and the demographics, 74% of the cases have been in the age range of 18 to 64 years old. So we thought we would show you all this graph and show you the trends. And like I said, you can pull that up at any time, that you want to take a look at that on the DHHS website. There's lots of COVID information there that you can access. And the county positivity rates, I'm just pulling those up. So all of LSC's counties that we serve in, except Buncombe and New Hanover, are in the red right now, which is the very high community COVID rate of 10% or greater. So out of all the counties we serve, most of them are in the red right now, which means that our staff are being tested twice a week. We have Buncombe and New Hanover. New Hanover and Buncombe are both getting very close to the red. They're in the high 8s and 9% range. So that just determines the frequency that we test our team each week.
Okay, thank you. And I'm seeing a few questions before I wind up. I am seeing a few questions come in. Someone asked if we needed to have an EpiPen on hand and Benadryl, and Lydia has shared that CVS and Walgreens, that's one of the reasons I am glad they're doing our clinics at all of our senior services communities, because then they'll have all the paperwork and they'll have all the emergency equipment, including EpiPens and Benadryl, anything like that. So if there is, in the odd event that there is a reaction, they'll be able to do that. I'm just looking at a few more. Somebody asked, a family member that's on the phone, and welcome to our call, asked if we knew when Trinity Ridge was going to get their first vaccines. And I believe, Keisha, have we heard from everybody? It looked like everybody was going to get their first round of vaccinations next week, the week of December 28th. Is that, Keisha, do we know that for sure now?
I haven't heard from every administrator yet. I've heard from
Okay.
Oaks and from Village and a few more, and they're that same week. So we're hopeful that it will start
Okay.
next week.
Very good. And somebody asked if the vaccine is preservative free. And Lydia says that the vaccine is preservative free. I see that now. Are there any other questions in the chat box, or does anybody else have a question that you'd like to ask at this point?
Ted, this is Dr. Chris Herman again.
Yes, sir.
I saw one of the questions about, if a person has previously had COVID-19, should they get the vaccine again? And right now the recommendation is yes. Much like any previous infection, we don't know how well the immunity has developed for that individual. And so this is basically would be getting a booster shot. For those individuals to try to help them to have that full immunity for, the risk of exposure in the future.
Hey, this is
Thank you.
I shared this morning with the group. I've got a building. We had an outbreak early in the COVID cycle and again, late in the COVID cycle. And in fact, we had 2 residents and the director of nursing that got it twice. First time the director of nursing was fairly sick, out for about 3 weeks, did not have to be on the ventilator. The second time had very mild symptoms, but it tested negative in between there. So it wasn't just an ongoing positive. And so it does appear that at least some people aren't getting full immunity from the virus itself.
So therefore would need to take the vaccine or should consider that.
That's what's currently recommended because of that. Yes.
Very good. Thank you.
And not only take the vaccine, but also continue to still on an ongoing basis practice the social distancing, the masking. None of that goes away.
Right. Good. Yeah. Thanks for mentioning that. We're gonna be with the 3 W's for quite some time yet, I see.
Yes.
Yes. Thank you for that. One of the things I think Dr. Corder mentioned, and we've been talking about a lot, we're working on a little campaign now. You'll see a little bit more of this over the next few days. But our campaign is Stick With Us. So stick as in stick the vaccine in your arm, but stick with us. And we're going to do some fun things around that. But again, it's just a way to get in front of everybody the need to take the vaccine. And Keisha has put up, I think that's Keisha has put up a picture. Keisha, do you want to explain that picture?
Yeah, that's Dr. Sirac, who's the doctor in Wilmington, and she tried to get on the call. I want to let you all know that we met our maximum capacity for the call, unfortunately. So apparently my account had some limited capacity, but the good news is we're recording the call. And we will share it instantly as soon as it's over for all of you who could not get on. She tried to get on a little late and wasn't able, but she did get the vaccine this weekend, and she reported to me this morning that she exercised yesterday and she's planning to exercise today, and she feels great.
Great. Good. Glad to hear that. But Dr. Corder was talking about who would you take the vaccine for? And just think about that person in your life, whether it's one of your residents or one of your family members or your grandmother or your parent, and think, who would I, the risk is so small in taking the vaccine that who would I take that little bit of risk for to save their life? And that's the person I hope you can kind of keep in your mind as we all make this huge decision. And I think it's going to be important that we have as many people take the vaccine as possible. I know there's lots of, things floating around the internet. But if you look at the science and if you listen to our medical specialists that are on the call, I think you'll see the importance of doing this and that they're all taking it. I'm going to be in line I'm not going to get in front of anybody because I don't want to get in the way. But as soon as I get the chance, I'm getting that vaccine. And I'm doing that for my mother, who is in one of our facilities, and my dad, who is at Trinity Oaks Independent Living, and all the other people that I come into contact with. And I hope you'll consider who that person is for you. Anything else that we can share today before we get off the phone? Our medical directors, thank you and physicians, thank you for being on this call. I know y'all are very, very busy, and it's amazing that you would take a little over 30 minutes to share this information, but I think it'll go a long way to help all of us to get comfortable with this. And if nothing else, I think we'll sign off. Keisha's going to send this out to all the administrators and executive directors. We'll probably post it on YouTube where everybody can get to it on our YouTube account. And thank y'all. And just look for more information coming your way. Keisha, have we covered everything?
I think so. Thank you.
All right. Yes.
Somebody just sent in on the chat, and maybe this is a good question for the doctors to answer. They want to know if they're allergic to penicillin, can they take the test to take the vaccine?
Yes, there's nothing that could interact as far as penicillin allergy goes with this. They should be fine.
Very good.
Thank you.
Well, that's a good way to end. But if folks have other questions, send them through your administrator, executive director, and we'll get one of these fine physicians to answer your questions. And thank you again. And y'all have a good rest of the day and have a Merry Christmas. Thank you all.
Bye, guys. Thanks.
Thank you.
Bye-bye now. Yep. Thank you.